And now what I want you to understand is there's a spectrum of fatty liver challenges. So even if you're like, I don't think I have a fatty liver.
The problem with the liver is by the time you find out you have liver damage, sometimes it's too late. Simply because the first signs of a liver problem are basically no signs. You don't know what's going on until sometimes up to 90% of that liver is destroyed. I have a lot of experience with this because I had liver damage early on in my 20s.
In tonight's Woman's Doctor, 1 in 4 adults in the U.S. has fatty liver disease. That's when fat builds up in your liver and can eventually cause problems with liver function. Obesity and diabetes are the most common reasons people develop fatty liver disease. Over time, the disease can become life-threatening. So medical director of the Institute of Digestive Health at Mercy Medical Center says it begins with silent symptoms.
We call it a silent epidemic because 90% of the patients with fatty liver disease, they don't know they have fatty liver disease unless they go through some test like an ultrasound or blood test. They will never know they have fatty liver disease.
Liver disease remains a significant global health concern, accounting for approximately 2 million deaths annually, which represents about 4% of all deaths worldwide. The majority of these fatalities are due to complications from cirrhosis and hepatocellular carcinoma, with acute hepatitis contributing to a smaller proportion. In the United States, chronic liver disease and cirrhosis were responsible for 54,803 deaths, ranking as the 10th leading cause of death. Recent data indicates a concerning increase in liver disease-related mortality. Between 2019 and 2023, deaths from chronic liver disease rose by 15.3%, a trend partly attributed to increased alcohol consumption during the COVID-19 pandemic. Globally, deaths from hepatitis B and C have risen from 1.1 million in 2019 to 1.3 million in 2022, underscoring the ongoing challenges in managing and preventing liver diseases. These statistics highlight the critical importance of liver health and the need for effective prevention, early detection, and treatment strategies to reduce the burden of liver disease worldwide. Do you know that in the United States, healthcare spending grew 7.5% in 2023, reaching $4.9 trillion or $14,570 per person. As a share of the nation's gross domestic product, health spending accounted for 17.6%. How do you know there is a problem in your liver? If you want to live long and enjoy the best of your life on earth before being translated to heaven at last, it is absolutely critical to take good care of your health and pay close attention to every organ and its function in your body. Careless people don't often live long. Your liver, one of the most vital organs in your body, deserves special attention. Let me ask, how do you know there is a problem in your liver? If you've experienced any signs that could indicate liver issues, drop your thoughts in the comment section below. But if you're unsure, here are some key symptoms to watch out for. When these signs begin to manifest in your body, don't ignore them. Visit your doctor promptly for diagnosis and treatment. Let's begin with chronic tiredness. Feeling persistently tired or drained of energy could be an early warning sign of liver dysfunction. The liver plays a critical role in detoxifying your body, and when it struggles, fatigue often sets in. Don't overlook this. Take action quickly. Another thing to look out for is yellowing of the skin and eyes, also known as jaundice. If your skin or the whites of your eyes begin to develop a yellowish tint, this may indicate an accumulation of bilirubin, a substance processed by the liver. This is a clear signal that your liver may not be functioning as it should. Pain in the upper right side of your abdomen can also be a warning sign. This discomfort might indicate liver inflammation or enlargement. In more advanced cases, you might notice swelling in the abdomen caused by fluid buildup, a condition known as ascites. If you feel this kind of pain or swelling, don't delay, get it checked out. Have you ever noticed your urine looking unusually dark or your stools appearing pale or clay-colored? These changes might seem minor, but they can indicate that your liver isn't producing or processing bile as it should. Nausea and vomiting that just won't go away can also be linked to liver issues. This happens because a poorly functioning liver struggles to filter out toxins efficiently, leaving your body feeling off balance. Sometimes the signs show up in your legs or ankles. Swelling in these areas, known as edema, is often due to fluid retention caused by an overworked or damaged liver. Pay attention to how easily you bruise or bleed. If you notice that even minor bumps lead to bruising or cuts take an unusually long time to heal, your liver might not be producing enough clotting factors, an essential function of this vital organ. Itchy skin is another subtle yet important sign. Persistent itching, especially without a clear cause, might mean bile salts are building up under the skin. It's easy to dismiss itching as something minor, but don't ignore it if it persists. Sometimes the signs are more subtle, like losing your appetite or experiencing unexplained weight loss. If you suddenly find that food no longer appeals to you or you're dropping weight without trying, it could be connected to liver problems. And finally, let's talk about mental clarity. Have you been feeling confused, forgetful, or struggling to concentrate? When the liver isn't functioning properly, toxins can build up in the bloodstream and reach the brain, leading to a condition called hepatic encephalopathy. This can affect your memory, focus, and even your mood. Each of these symptoms is your body's way of trying to communicate that something might be wrong. Don't ignore the signs. Early detection and action can save your life. If you've noticed any of these changes, consult your doctor as soon as possible. Your health is priceless, and taking care of your liver is essential for a long, vibrant life.
5 drinks that can help remove fat from your liver. First of all, what is your liver? Your liver is an organ in your body. It's one of the largest organs in your body, and it actually plays an absolutely critical role to detoxify your body, but it does it through your blood. So your blood sends a huge amount of volume into your liver. Your liver actually filters it, and the cells in your liver actually basically clean your blood, remove those toxins, and send it on its way to actually go get more oxygen and nutrients to be pumped out.